Good afternoon, and thank you for watching CTV News Channel. I'm Jennifer Burke. The new Atlantic bubble could already be in trouble. Prince Edward Island is reporting 3 new cases of COVID-19, the island's first cases in 2 months. Officials say the cases are not connected to the new Atlantic bubble, which began yesterday. However, that doesn't mean the bubble, which lets Maritimers travel freely within the 4 Atlantic provinces without self-isolating for 2 weeks, isn't in jeopardy. While there's no change right now, that doesn't mean things won't potentially change next week.
We will take the next 24 to 48 hours to allow the contact tracing and the Chief Public Health Office to do what they are prepared to do. And we will let the information guide us at that time. We've said from the very beginning if we need to pull back, we would. And if the public health information and the epidemiology points in that direction, then we would be prepared to make a decision on pulling back early next week if that's where the information points to.
For more on this, I'm joined by infectious disease specialist Dr. Brian Conway. He is in Vancouver. Dr. Conway, this has to be a disappointment for Maritimers. Are you surprised, though, that we're seeing a couple of cases?
I'm absolutely not surprised. We know that the virus is still among us. We know that the key to maintaining the Atlantic bubble will be to finding the cases quickly, tracing the contacts, and limiting the impact of each and every case. It is still possible that this will occur. Events over the next week will be important to follow in terms of whether the Atlantic bubble can be maintained.
You know, people were so hopeful that this was happening. And in your opinion, was the Atlantic bubble a good idea? And if not, though, how long were people supposed to wait?
It was an excellent idea. This is about balancing public health with the health of the public. It was timely to have the Atlantic bubble. It is not at all, to me, unexpected that a few cases have been found. That is a tribute to our testing strategies. Let's see if our contact tracing strategies are sufficient to maintain the Atlantic bubble as it is today.
Right. Let's find the positives here for sure. So what major things do people need to do and keep in mind as they travel from province to province?
Well, I think personal distance has really served us well. Stay 2 meters away from everyone if you can. Wear masks when this is not possible. Stay home if you're sick, and tell people if you feel sick and might have COVID, so that we can allow our excellent public health interventions of testing and tracing to come into play to preserve the bubble and maybe even expand it to other provinces.
Exactly. Let's talk about the masks for a moment, though, because in a few days, masks are going to be mandatory in all indoor public spaces in Ontario. Your thoughts on that? Will people adhere to that mandatory rule?
Well, this is part of trying to keep reducing the total number of cases that are being diagnosed. The settings that are being selected to mandate the use of masks are those in which personal distancing cannot be maintained. I think it should be the habit of all Canadians going forward to have a mask in their back pocket, and whenever they feel they're getting too close to people, to wear it. If we have to mandate it for a short period of time, force people to do it while we continue to flatten the curve, then so be it. But I see a time going forward in the not too distant future where masks will be optional, and it will be perfectly natural for us to pull out a mask when we're getting too close to people.
Okay, I got a minute left. It's July 4th, south of the border. You know, a very busy weekend down there. The U.S. is hitting record cases in some cities. What's your prognostication for what's happening there?
Well, I'm running out of words to describe it. This is a disaster. I think this is where politics has intervened in what should be a public health intervention at a national level. There were pieces on American television over the past day that say that the reason that Canada has done so well is we've kept the politics out of it. I wish our American neighbors a very happy 4th of July in success in separating public health from politics going forward, so that at some point in the coming months, many months, we may be able to think about opening the border.
Do you think it's going to get worse before it gets better?
I am convinced it's going to get worse. And I think all of the public health authorities in the United States have said that very clearly in the past few days. And let's hope that a tipping point will occur when the American public will believe the public health authorities over the politicians. That is what actually needs to happen.
Infectious disease specialist Dr. Brian Conway joining me from Vancouver. Thank you, doctor.
Let's all be safe in Canada.